You're watching News 3 at 5 with Jim Snyder and Sue Manteris.
Well, most of us have aches and pains, but getting rid of them sometimes is a challenge. And Healthline 3's Beth Fisher is here to tell us about a new therapy.
It's a new therapy, and patients are finding some remarkable relief with it. It's being done at S.P.O.R.T.S Physical Therapy here in Las Vegas. To say the therapy is unusual might be an understatement. And though seeing is believing, in this case, the opposite might be true.
Toes up toward your nose. Good.
It looks like quackery, and physical therapist Scott Pensivy would be the first to agree with me.
Well, the first time you saw it, you thought, no way.
It's crazy. You know, it took me almost a year to be convinced that it worked.
It is Primal Reflex Release Technique, or PRRT. The therapy is used to trick the central nervous system so it stops working overtime, and you feel pain relief.
It's difficult to explain, but what essentially are you doing?
We're taking the body and bringing it into homeostasis. We're trying to downregulate the pain, going after what we call the sympathetic nervous system.
I don't really understand it, but I just know that he'll touch places on your body that hurt, and then he'll do it, and then it doesn't hurt, and you're like, all right.
Pro golfer Scott Piercy is a believer, and so is Dr. Garcia, a family practitioner.
I thought it was crazy. I said, well, this is probably, some other gimmick, but if it's not going to hurt and it has no side effects, I'll try it.
Dr. Garcia tried PRRT after shoulder surgery. Even her surgeon couldn't believe the difference it made in just 2 weeks.
Viewers are going to see this and they're going to think, this is just the hooky pookiest thing I've ever seen. But you are a believer.
I am a believer. I actually treat patients with chronic pain, and I actually brought this technique to my group.
This is real thick.
Yes. Oh, that hurts.
I decided to put Scott Pensivy and PRRT on the spot. I'd had pain in my lower back shooting down my leg for 2 weeks.
And it's helping patients with fibromyalgia, chronic pain.
Acute pain, again, and I use it in my practice to assess whether it is a dysfunction or derangement. If it's a derangement, like a tear like we talked about, we're sending them off to specialists.
And Pensivy says he'll know if it's working within 3 to 4 visits, but many patients feel immediate improvement.
Better than it was?
Oh, yeah.
Okay. How about here?
Not sore at all.
How about here?
No.
Remember before?
Yeah.
You jumped over there.
Instant relief, but would it last? I did not think it would last. I walked out of there thinking, we'll see. I shot that story 2.5 weeks ago, and I'm still pain-free. It is not a miracle cure. If you have a break or a tear, this is not going to help you. But the good thing about it is that Pensivy claims he'll know within 3 or 4 treatments if it's going to work for you. So it's not like you're going to be going for a year wondering if it's going to work.
How often do you have to go?
He'll know immediately whether it works for you, and then you may have to go a couple times a week in the beginning or once a month for maintenance. Each treatment costs about $100.
Okay, very interesting, and I'm glad you're still pain-free.
Yeah, thanks.
Okay.